see. Right. Very good. Good afternoon, everybody. My name is Maria, and we are doing this nice interview with a good friend of mine. This week here in Trinidad, we are celebrating our Awareness Week. Um, Unfortunately, because of the coronavirus, we couldn't do what we always do, like we go outside, we do free massages, we share information, we let people know about massage, the benefit. This year, unfortunately, we have to do it like everything else, virtual. And well, it has been a completely success during all this week. Um, and it's amazing how we are transforming what we used to do every year, but it's working. And for today, I want to introduce you. I know many people know her, to Mrs. Marcelina White. She's from Trinidad and Tobago. She's a licensed massage therapist, but she's also the gold medal for the our Latin American Championship in the online version, the 2020, and also she got the third place overall with her presentation. It's amazing to have you here. Hi, Marcelina, how are you?
Hi, thanks. I'm good. How are you,
Very
Maria?
good. I'm great.
Yes.
Surviving coronavirus.
Oh, that's wonderful.
Yes. So, Marcelina, um, give us an introduction as who is Marcelina White?
Well, first of all, as you said, I'm from Trinidad. I was born here. I've been raised here. I'm 42 years old. I'm a sister, a big sister, and also a little sister. I'm an auntie, daughter, granddaughter. There's a huge legacy throughout our family history of the art of traditional healing. So it's passed on. I'm hoping to pass it on myself. I am also a diploma massage therapist. I am a licensed massage therapist. I'm a certified chair massage practitioner, and I have been studying a lot of the other arts.
Very good. It's very interesting. What are you saying that you are a massage licensed therapist, right? But what you present in our championship in Latin America was something that really was not is not well known in the normal occidental massage. So telling me and talk about the technique that you use to win the gold medal in the championship.
Okay, well, my great-grandfather came here in India, laborer. His name was Nakedi. He brought with him his skills in the healing from the Ayurvedic aspect. It was passed on to my grandfather, Patanjali, and he really developed it. He was well known in the village. All of the footballers and cricketers playing for the local clubs, every person who had a child, they would go to Jari, they would go to get rubbed for some kind of issue, with babies you have hassle. So they would go for that reason. When we were small, we would rather go to him and have him treat us before we go to the doctor. We would cry. In fact, I remember crying once at the doctor's office and saying, take me to Papa because he will make me feel better. I was afraid of doctors too.
Oh, yes, of course, I can imagine.
So, we got to see him rub and crack and pull and adjust and just have somebody come in pain and walking, like if nothing ever happened to them. So it's something we strongly believe in. And as the years go by, every person was able to gained some techniques from the family. When we were really young, my aunt used to line us up. She was like about 10 years older than us. So she would have us in a line because there were about five of us in the age group. We would go back, and there was to see who could eventually let go the hand or let go of the wall to stand and walk on him. So it development part of the journey was it was fun, it was a challenge. And we were like a few girls among the boys. So anything they could do, we wanted to do better.
Yeah, of course, and I can imagine. And the amazing thing of the technique of what it was amazing for all of us in Latin America, because we don't have that kind of massage. It's the weight of the balance of your feet. I think that was the key. That was the
Yes,
champion. The way how you can handle it, like your feet. It's like you use it like a hand. You
yes.
are under the person's body. But what I want you to explain us is that you are not exactly under the person, like you use one part of your body. So explain us how is the anatomy of the technique in your feet.
Well, because we started so young, I would say, then getting into massage therapy, learning the body, understanding what you come across when it comes to issues. So you understand what's a scar tissue that you would feel. You understand when the muscles are just under tension in a particular area. You learn to
Mhm.
understand what bones and joints they would be affecting. And basically, the feet develop the same type of sensitivity as the hands because I have the knowledge from schooling, from formal schooling. I'm able to
Mhm.
translate that knowledge down through my entire body in the feet and the feet up to the brain. So I can translate what it is I am feeling and then adjust my foot to suit. So I would know when I could use the edge of my feet, when I could use the ball of my feet, whether to just stand flat
Mhm.
or walk on the area, and I would get the relief and incidental adjustments as needed.
Okay, exactly. So it's just like the hand, like we have certain areas that we call it like the
Yes,
anatomy of the hand. So the foot also has their anatomy. So you know what part of your foot used for certain areas
right.
of the body.
Yes, yes.
Oh, it's amazing. So my next question is like, how long have you been doing this?
Well, we started, I was probably about 2 years old that I can remember when we started learning to walk holding on to someone's hands. And over the years, the technique would have been they added things gently. The older people were so wise. They didn't teach you
Mhm.
formally. From time to time, they would call you and show you something, right? And I remember working. I was doing
Mhm.
fiberglass work at a boating company. And I would go home in the evening, and even the man in the bread van would stop and ask for a crack or something. And I said to my mom one day, listen, I think I need to start charging for this. I have to find a school, you know? So, but I left it at that. And eventually it came around that I did find a school just accidentally one morning going through the papers. But developing over the years, learning little by little, having various members of the family tell you, come and crack my back. I mean, my aunt was a big lady, and I am like 16 years old, and she's like, come and crack my back. Look at me. How much pressure can I apply? But you learn because they displayed a lot of confidence in us based on what we were taught. So if I know Papa teach you to crack, then you have to crack my back, you know? So
Exactly.
that's how the confidence and everything developed over the years.
Yes, exactly. That is what we're trying to explain in the disclaimer that we put in your video about like these, even if you see it so easy to do, you need to know the knowledge. You need to have, that expertise to understand that this is not something that you should have, should be doing if you don't have the proper training to, I manage something similar like you do, because we are very similar, and
Mm-hmm.
I use an stick. I kind of, I don't have the balance that you have, and that is what I think was amazing and fantastic when we saw your videos, because I have to, I don't have that ability that you have to hold, with just your fingers or your toes. It's
Mm-hmm.
amazing. I think that is, you know, is really just amazing. So my next question is that is it's yeah, it's like how you can explain what you do to other people, that they say, oh no, this is easy, I can do it, I can walk on a person back.
It's not easy, and I have learned over the years that looking at a video, even a tutorial video, does not give you the same formal learning or experience of learning as hands-on, as being in the presence of the person who has the knowledge to impart. So it may look easy. It may look like even with a stick we can do what I did. But if
Mhm.
where you may step on the person's spine, or you may not understand what you're feeling on the foot, and you could be feeling the head of the rib, and you can say, okay, I know it's a crack, but it may not be a crack. You may have just displaced the rib. So I really do not advise. The same thing with adjusting the uterus, putting it back in place. There's so many things you need to know. You need to know where the uterus is supposed to be. You need to know what the uterus feels like. If it's out of place, you need to know if that is so, how you should locate it, the ovaries are. That way you will determine if the uterus is turned. You need to know what the uterus feels like if somebody's in the early stages of pregnancy. So it's not something
Mhm.
that you can just look at me on a video and then decide, hey, I could try that. It doesn't work that way. Because it took us years, and even after being talked through each session until my grandfather, and they sit and they did describe and thing, and you look on and you look on. It took me 2 years after I started working with him, looking on, for him to take my hands, put it under his, and say, let me show you. And there was a vast difference in the amount of pressure I was applying versus his. I mean, although he told me gently, but his version of gentle and mine was certainly different, right?
Yes,
So you need to
yes,
know
of
the
course.
depth in which you need to go down to actually make a difference within those internal muscles, and be aware that there are a lot of muscles within the pelvic region. So you have to know what to
Mhm.
access in. And the techniques does not in any way resemble the techniques that we learn formally as massage therapists. They
Mhm.
are different.
Mhm. Yes, exactly. And that you led me the other question, because what you present was like two different techniques, because after you did an abdominal massage that you said that it was for after pregnancy. Most of the time here in this part of the world, I'm saying Canada down, even Latin America, we just have the baby and that's it, and you move forward with your life. Um, and it's very surprising that yes, we have an after pregnancy massage to help to release and for the mother to recover. So talk us more about the abdominal massage after pregnancy.
Well, what you all saw in the video was actually just one aspect of the abdominal massage. Usually,
Mhm,
to start that work, you start from under the rib coming down, because the womb normally stretches that high. So you have to start bringing
mhm,
it back down, which is aided by the baby breastfeeding, of course. And then when it's back down, you need to start with the where the scooping up and stuff comes in, and the tying to encourage the muscles to relax back into its normal place. And you have other incidental benefits like the skin changes because a lot of the time the skin gets darker among our Caribbean people. So the color of the skin changes, you start getting some of the elasticity back because this is something that is done over a matter of days. So it's not done once. You have to do it several times. And then you have the herbs, you have the steam baths, you have the teas, and all of those things are added to it.
So, for example, I have my baby, and I can imagine that there are two procedures. If I have it in a natural way, or if I have a stick session. So, how
Right.
long do I have to wait until the time they say, okay, you have to wait how many days or months to start that abdominal therapy?
For which one? The C-section?
Yes, for the C-section.
We don't usually rub the abdomen. You can wrap and tie to keep the muscles in and as low as possible. And you can work on the back because those muscles in the back would have been stressed. So you can work on those muscles on the glutes, on the back, and the legs and stuff. The abdominal muscles you leave alone except for the wrapping. You can keep adjusting the wrapping over time so the belly gets flatter. But dealing with the scar tissue aspect will take place 6, maybe 8 months down the road, depending on how fast the person heals.
Okay, so it's more recommend. Sorry, like you can recommend it more for people who had in a natural way, or for both ways you can do it. You just adapt the
Well,
technique.
traditionally, it's usually done for people who have had natural birth, but there are families that would have done certain types of massages leading up to the time of birth, which would have increased the chances of a natural birth greatly. So there are certain families that they would do a certain type of rub and adjustments and stuff to make sure the baby is properly positioned and all of the muscles are very receptive. So a natural birth was always a better outcome.
Okay. Yeah, of course I can. It's like I tell everybody, like adaptation is always coming, far with the technique because before in the time that probably your grandfather was using the technique, like this C-section was not in they couldn't
Right.
do it, the doctors, so they have to do just natural birth and that's it. So now we have the C-section, so we have to try to adapt the technique to try to help those women also. But probably we're just a part of the treatment and not the whole one, because of the condition of the wound.
Yes.
Okay, fantastic. So my next question is like, how are you surviving COVID?
It's been, yeah, well, we did have our quiet months, but I have been pretty busy. Most of the times I work probably 3 or 4 days a week, and I have scheduled my appointments. So instead of doing 4 or 5 a day, I now do less because I want to make sure I have sufficient time to do the extra cleaning. Now, the thing is, we have always been diligent with cleaning, but due to the COVID, you now have to be aware that this door, I can't bypass this and I have to clean it now. I don't let anyone touch my light switches and everything. I'll have the tissue there so they can use it to open the door. But sometimes people forget, so you need to make sure they're clean. All of the protocols from outside come in, even via the phone. All that is taken care of. People are always reminded to make sure you come with your mask, otherwise you won't receive treatment. So, so it has been, the only challenge is that I had to cut down on how many hours I was working a day. But then sometimes we need to do that. So in everything that it seems adverse, we have to look at what's the best scenario, what's the best thing in that. And for me, it has been that, the opportunity to slow down.
Yeah, of course. And what I want to explain people, and I'm glad that you are here with me to explain that too, is like the way that we always, even before COVID, we have a cleaning regime. Like we change every bed sheets, every set of towels,
Yes.
everything, and
Everything.
I, in my opinion, it's like massage, unless you go to, I don't know, somebody that doesn't have the training, um, you will find marvelous cleaning, even now, I don't know if you are doing it, Marcelina, but it's like changing your clothes with every person, to secure that, uh, like you don't pass something that the other person brought to you to the next one. So massage is very safe unless really it's not doing it by a proper training therapist.
Exactly. What I have been receiving a lot of is clients saying how much they appreciate the fact that we are so conscientious about being clean and being overly cautious, and no one has yet had a problem with filling out the COVID liability and all of the other screening questionnaires. They have diligently filled it out and expressed appreciation that we are going this far.
Mhm. Exactly. Yeah. So that is what we want to let people know, that it's secure to go and see your therapist. And in fact, I think now with this pandemic, the level of the health has reduced tremendously. And it's
Yes.
not just the pandemic for the COVID, it's also depression. People is not doing any activity, so they are all the time sitting in a couch. So the muscles started to get stiff, bad posture. So really, a good session of massage will give you that release, not just physically, also mentally. You know, so I think is unnecessary.
It is. One thing it has brought to us is how important touch therapy is. You know,
Yes,
of course, we have
but it,
our pregnant women, or they want to now have babies. They would be a little extra cautious.
mm,
Um, so that aspect of the work would be for me more among family members, because I have a large family. So somebody is always having a baby. I have to do one shortly, right?
that is
So, but
good.
those are the ones that we would definitely agree with, to be extra cautious about stepping out
Mhm.
and seeking the help that they do need. So we do have to figure out a way. But for everybody else, it's been just take your regular precautions. Be responsible for your own health. Don't make your
Yes,
massage therapist or your doctor or the person at the grocery store responsible for your health. You are responsible for it.
yes, and I think that is what it is. And what is amazing about what we are doing with this virtual um, situation, it's like we are sharing more knowledge. Because believe it or not, I think COVID has brought, other opportunities to grow. You see, you won the gold medal in Latin America. Probably, if no COVID were in the panorama, probably you won't, you know, just don't know about it.
Besides that, though, I would definitely have not entered. This has been a really good experience. It has been, I'm still, this morning I actually put the certificates up, because for me it's like I'm still in that place where I really did it. You know, I am like, I really did it. My grandfather called, he was so proud, you know, on the day of just before we got the final results for the final competition, he called to say how proud he was that I was taking the family tradition so far. Even my uncle, because he's not here, he's in the States. So they were just so happy to see the lines, the development of the family traditions was going along, because currently I'm the only person taking it forward within our this generation. Hopefully in the younger ones I'll be able to help more of them develop. So For them, it was an eye-opener that something we grew up with, accustomed to, it's a way of life, could have made a huge impact on people throughout the world, you know. And
Yeah,
listening to Rhonda's journey yesterday, I was I was shocked. She almost moved me to tears to see how much knowledge I had imparted to them and the impact it made on them. And for me, it was, this is part of my life. This is what I grew up with. This is
exactly.
what we know. So for us, it's not amazing, but if we had to sit and look at it, yes, it's amazing. It's amazing what we can do. It's amazing how the human body recovers from anything. And it's amazing that we can express love and caring for fellow man, not only to treat, but to share the knowledge that we have. And we do it freely. I do it freely.
Yes, it's amazing. It's amazing. And as I tell everybody that in the way that I imagine the championship was that it was like uh let people know people like you, because probably
Mhm.
and it's most of like that, like when you go to this championship that on site, probably the person doesn't have the resources, the time to take a plane and cross around the world to do that. So my idea was that encourage people like you to show something that like you show, like I we want the traditions, because that is what usually get lost, because it's not probably supported by the occidental medicine or the occidental massage. So I wanted, my mission as a founder of the championship was that is like let people know that we have an amazing therapist like you. We use like other Latin Americans also, they present every massage from the region, and it was amazing. It was 100 people, 20 more than 22 countries, and it's amazing. And you got the third place overall. I think it's amazing.
It has brought home to me being out for the past couple of years, working among therapists outside of the country, working among athletes from outside of the region, and especially in Trinidad, the Caribbean is unknown when it comes to massage therapy. But especially in Trinidad, what we have discovered, what we have noticed over the past years, is that we do have a different level of training. We do have a more medical approach to massage. For us, it's all about health. It's not about any, I mean, being able to take care of yourself at a standing is does play a big part, especially in your mental health. But for us, it's a
Mhm,
lot about physical health.
mhm. Yeah, and it's amazing, right? I tell everybody that if you join the camp Facebook page, you will see now that a lot of the therapists, the members, are advertising their treatments, and it's amazing. How do you have
Yes,
like a huge variety of techniques,
yes.
and it's amazing. It's amazing. I'm surprised of the amount of people that I didn't know, it's like, oh, this girl do this, oh, this person do that. So uh, I think the idea of sharing that, Marcelina, was just fantastic.
I think we'll probably reach more people this year than we did in the past years being at a
Yes,
physical place. Yes.
yes. So COVID is not so bad. I think it is giving us the opportunity of new more people. I now for the championship, I had plenty friends now in Facebook, new friends that they participate in the champion, and I can imagine you too. So it's amazing.
In adversity, we always are able. Humans are very resilient. And where there's a will, there's always a way. And we have made it happen. Once again, camp is leading the way. And we are doing things and going places. And as long as we are all willing to work together, no one will be left behind.
Yes. Yes, and that is what I love camp, and in particular, like you and Mr. Davies, they are so, that heart that you put in your work is amazing, and that is why we love and to do the fusion between the Latin American Association and the Caribbean Association, because as we told you, all of you, like we believe that the Korean is part of us, even when you don't speak the same language when you speak Spanish. But I
Right.
think all of you are part of us.
Right. Well, historically we are, but that's another topic.
Yes. So it's amazing. It's fabulous. And I know that our relationship is going to grow more,
Yes.
and I know that we have an amazing plan for the future. Um, and to close this interview, Marcelina, you as a therapist, they are therapists now. They are in a very terrible situation. They are not getting any jobs. Um, so, what is your advice for them? What they can do to improve or to share the knowledge so they can get new clients, new people to come in?
For now, you have to develop some grit, some willingness to stick to it because things are going to get better.
Mm-hmm.
Touch is something people will always need. My advice is to take the opportunity every time it's given to learn, develop yourself, keep your integrity, always rely on your professional ethics, love yourself, love others, teach as much as you learn. Don't hold on to the knowledge because it takes us nowhere if we keep it.
Mm-hmm.
Share it freely. It's going to come back to you and multiply. I actually look at this entire competition and the results as an opportunity, not just for myself, but for
Mm-hmm.
camp, for Trinidad, for therapists, to be known really, for people to understand that massage is a serious thing. And we, in order for it to be taken seriously by others, we need to take it seriously.
Mm-hmm.
If this is what you love, don't give up. There are times when you may need to take a rest, take the rest. There are times when you may need to just step back from doing massages and walk away from the business a little. Do it because you need to rejuvenate. You need to find your second wind. So do it. Take the time and develop, grow, learn, stay humble. And this work more than anything to be humble. I learn every day. I learn from clients, I learn from other therapists, I learn from my family members and how they interact with to come to me or how they reach out to people who are in need with pain like that. As long as you are willing to be quiet and to listen and observe, we will learn a lot. I have learned that we all have a place. The doctors have their place. The massage therapists we have our place. The physical therapists have their place. The physical trainers have their place. And I work with all of them.
Yeah.
Successfully. Because I know my place. So I would never presume to determine something that a doctor's diagnosed or say it is wrong. If for some reason what I as a therapist am observing on a client, because of my experience with muscles, maybe more than the doctors, then I would advise that they go back to the doctor or they see another one. But I'm not here to diagnose. I'm here to advise, to treat, to provide a way out, to help you understand your body, and I usually tell clients who are in recovery, 80% of the work belongs to you. As a therapist, I am here to treat, I'm here to guide, and I'm here to be a sounding board. At the end of the day, we will be successful as a team, but you will be doing the majority of the work. And we need to keep that focus, that humility to know that I have been blessed with a skill that I have been determined to develop formally. I've taken my gift and I have multiplied it. But at the end of the day, I am not God. I am not a healer. I am a vessel to be used. And I'm willing to be used to be a vessel for someone's healing. But it takes a team, and the team is usually you and the client and the doctor and whoever else may be involved in them living their healthiest lifestyle.
Those were beautiful words, my dear. So what we want to share with all of you is that, like, if you go and you do massage, remember that we are no magicians. We are just there to assist you. That is a 50-50, and it depends of the commitment and the respect that you have for what the person is doing. Giving it a chance. One massage session is not going to do miracles. You need to be constant in your sessions with your therapist. A good communication is a like relationship. You need to communicate with your therapist what you not agree, and instead of go outside and criticize the therapist, you tell them, you know what, I think we should do this the same. So if the therapist is qualified, it will listen to you and it will adapt the technique to you. Okay? And if you are outside and you don't have a job, now the social media is an amazing platform that you can go, you can share information about your technique. Like you can get it in our Facebook camp page, where you can see amazing therapists and look for better health during COVID. My dear Marcelina, you know that I love you so much. Thank you very much for your time. I know it's a Saturday, but I appreciate it so much. What are you doing? Marcelina is in the back of everything in the camp association. Is the heart. I always tell her she's the heart of camp, and without her, well, probably this won't be, So thank you very much for your job and your last words for people outside.
Thank you so much for having me, Maria. I hope that what we have done this week would have a tremendous impact on people. Should you be interested in finding a therapist, you can go to our website. You can use the shortcut bit.ly/camp2014, and you will be able to find therapists in your area and seek your health, seek your best interests. We're all here to help, but you got to help yourself too.
Exactly.
Have a good evening, everyone, and thanks, Maria.
Thank you, my love. Thank you, thank you, thank you. Have a wonderful weekend. To everybody else, thank you very much for watching us. And remember, follow the camp Facebook page for more information about therapies and more about massage. Thank you very much. Muchas gracias a todos.
Thank you.
Hasta la próxima.